The government, through the Office of Director of Public Prosecutions, has finally dropped a court case brought against cosmetic dermatosurgeon Dr. Pranav Pancholi and his clinic Avane. Dr. Pancholi had been accused of operating a health institution, that is the clinic, without a license and publishing false advertisement in the days after Kenya confirmed its first COVID-19 case.
The post was not supposed to be published until the COVID kits come into the country. But what happened is, when they're using social media, they use a program called Hootsuite. And that what it does is it's supposed to automatically post on certain days and certain times and everything. And something went wrong with the programming, and the post went up before the kits had come in.
Advocate Andrew Muge, who represented Dr. Pancholi and Avane in court, said that his client has finally been absolved in any criminal activities and that Dr. Pancholi is a professional who has only been interested in healing his patients.
He had been charged, Dr. Pancholi, with the offense of publishing information that was false. It's false advertisement. And also operating a hospital without a license that was not registered, which after time, it was rather obvious that, one, his hospital is registered, he's a registered doctor, has been for many years, he's licensed to practice, and the publishing of the advertisements was not true. He did not publish any advertisement at all, or one that was false.
Speaking to Dr. Pancholi, he expressed gratitude that the case has been concluded and that he can now go on with his work attending to patients in need of dermatology and cosmetic services.
This is essential medical care that patients need, and I'm just happy to not have a criminal court case over my head. You can imagine every 3 months going to court thinking this is a criminal case, you can be arrested, and like the fear and the anxiety and all of that I went through was it was really a trying time. But I thank the government of Kenya for making the correct decision.
During the time that the case was in court, not only was his business affected, but also more than 50 employees who he tells us he had to pay even when the clinic was not operating.
We have over 50 staff. I pay salaries for 50 staff every month, and we still continued paying everybody's salaries. There some of my staff, we pay the school fees for them. Everybody at Avane, we give a lunch to everyone, yeah. And with the clinic shutting down, like not just me, but the livelihoods of over 50 people that work at Avane were affected. So it was a really tough, terrible ordeal.
These caused a lot of damage, both financial and emotional. But as we've decided to take it, we advise our clients, and sometimes, on the legal avenues that he has to challenge and claim such damages. But in his case, he's more interested in going back to helping his clients and treating those that need treatment and just going on with his life.
His license to practice as a medical doctor was also suspended by the Kenya Medical Practitioners and Dentists Board and has since been reinstated. Avane Clinic was also determined to have been duly registered and has been allowed to resume operations.
Avane Clinic is back. It's bigger. We've invested in new technology. We have new exciting treatments that are available at the clinic. And we are open and we are treating patients as before, and actually we have grown during this period.
At the moment, Avane Clinic now operates 3 clinics in Nairobi at Yaya Center, at Park Suites in Parklands, and off UN Close in Gigiri. Robi Omondi, K24, Nairobi.